Hey there, it's Dr. Justin Marchegiani, and today's video is going to be on parasites. Do you have a parasite infection? And again, the symptoms really are across the board. We have our conventional parasite symptoms, which may be bloating, maybe some gas, right? We may not feel too good, or we may have some diarrhea, maybe some constipation, but we also have some symptoms that may be a little more unconventional. Again, we may have grinding of our jaw at night. We may have a hard time feeling full or feeling satiated. We may also develop certain nutritional deficiencies such as B vitamins, whether it's B12 or folate. These B vitamins are really important. If they go too low, it could be classified as an anemia. And again, if we don't have those B vitamins, we can't build our healthy red blood cells to carry oxygen and nutrition. And we also need B vitamins to make thyroid hormone and to have healthy adrenal function. And again, we also need iron to help carry oxygen, and a good portion of iron is used to actually make thyroid hormone. So these nutritional deficiencies can throw off our endocrine system and affect our body's ability to create energy and or regulate inflammation. So nutritional deficiencies is definitely one as well. Again, a lot of people don't realize they have a parasite infection. One, because typical mainstream medical doctors, they aren't really looking for it. Parasite infections and diseases are things of the third world country, supposedly. I run parasite infection tests all the time, and I see a lot of my patients infected, about 70%, I'd say. Again, when we address the hormonal imbalances and the dietary imbalances and remove the infection, magically they do start getting better because we're just reducing inflammatory stress. But again, this concept, this mindset that parasite infections are only found in the third world country really isn't true. Again, in the third world, there's going to be more parasites because we don't have good, clean running water. We don't have good sanitation. Living quarters really aren't too sanitary. And there's lots of nutritional deficiencies. And you can think of the commercials back in the day where you'd have the distended child's belly. That's kwashiorkors, or it's caused by a protein deficiency. So that distension in the stomach is not caused by overeating. It's caused by a lack of protein causing the stomach to fill with fluid. So nutritional deficiencies, poor environment, stress of not having a roof over your head, all of these things are going to lower your immunity and potentially increase your chance of a parasite. Now over here though, I'm still seeing it, and a lot of my colleagues are seeing them as well. And what I can think is here is that we have lots of stress, we have lots of calories, but poor diets regarding nutrition, a lot of not too much nutrition, a lot of calories, but not a lot of nutrition, whole bunch of stress, not sleeping too well, and again, not a lot of people exercising. So we're still under immune stress, and I mean, we're seeing it. When the stool test comes back, it's not lying. So again, signs and symptoms, we have the unconventional and the conventional. The unconventional tend to be things that aren't necessarily dealing with the intestinal tract. It could be memory, it could be mood. There was a study I'm going to mention in my blog where they actually looked at children, and they found children that had parasite infections, they had less cognitive function, less focus, and less ability to do tasks. So parasites can actually affect your ability to focus and get things done from a cognitive mindset. Infections produce inflammation and biotoxins. So these parasites spit out various toxins, and they can affect and put stress on our body. They can put lymphatic stress, because again, our lymph system is the interchange between the tissue and the blood, and we have to carry toxins away. And if our body becomes overburdened, that lymphatic system can be congested, and we can see swollen lymph nodes. So we want to make sure the lymph is able to move with these parasite infections, because it's putting lymph stress on it. Again, our detoxification systems are also stressed. These would be our cytochrome P450 pathways, the phase 1, phase 2 pathways that help take our fat-soluble toxins and make them into water-soluble toxins and excrete them. Again, our detoxification systems have to work on overdrive to help, one, excrete the infections, kind of like pulling a dead soldier off the battlefield. These infections are lining our whole intestinal tract and maybe outside the body, and when they die, we have to come in there, and our immune system has to come clean them up. And also, immune stressors. Like I said, our body has to create maybe eosinophils or various white blood cells that come in there to help knock down the infection. And again, various biotoxins are produced. So like for instance, when we're dealing with bacterial infections like H. pylori, we see endotoxin, which is again endotoxin. So it's toxic. We have various funguses like candida and such. They produce mycotoxins. Myco stands for fungal toxin. And then we see things like SIBO, which produce lithocolic acid, which can unconjugate bile, help cause reabsorption of hormones, and put stress on the body as well. So you can see lots of different biotoxins are produced. And again, this puts more stress on the body. And again, when we see these various infections, we have our immune system here. And typically, we have our Th1 and Th2 immune system. And with big worms, they typically increase Th2. With smaller parasites, intercellular, so we have intercellular inside the cell, small guys, and extracellular, these are the big ones like the worms. Typically the extracellular parasites will increase the Th2, while the small guys increase the Th1. Now, there's various studies looking at using worms to help shift the immune system in various people. Again, there's one study looking at the Ascaris lumbricoides worm, which actually increases the risk of allergies. So when you have one of these infections, it can shift around your immune system. Now, there's actually some decent research showing that kids in the early ages, between 0 and 3, getting exposed to various flora and infections in this time frame can actually help your immune system. Now, after this time frame, it can actually increase various antibodies and increase autoimmune conditions. Again, in one study that looked at Ascaris lumbricoides, again, increasing the Th2 and increasing asthma. Again, there's also studies looking at h. pylori, for instance. When people have h. pylori as they get older, for instance, they actually find that h. pylori, when eradicated, will actually decrease thyroid antibodies. Same with a parasite known as Yersinia enterocolitica. When that parasite is removed, thyroid antibodies also go down. So we do see that parasite infections do have an effect on the immune system, maybe some beneficial effect in the early years here, but afterwards it can definitely cause problems. And again, if you're having a parasite infection that shifts the Th2 system up, it brings the Th1 down. And Th1 is more of our natural killers. These are more active with bacteria and virus. So if we're really prone on the Th2 side, we may be open to bacteria and viruses. But again, if we're really high on Th2, we may be prone to allergies as well. And vice versa, if we're low on the Th2, we may have a harder time dealing with other infections. So there's this kind of a confusing shift here that's happening between Th1 and Th2. But again, parasite testing. If you have a parasite, I strongly recommend getting rid of it. It's putting a stress on your immune system. My thing is, look, let's see what the stressors are on your immune system. Let's remove it, and let's let your immune system do what it naturally needs and wants to do. So there's a couple different tests you can do. I'm a big fan of BioHealth's 401H test, as well as Genova's brand new 2205 and Doctor's Data stool testing as well. And if you want to get access to those stool tests, feel free to check the links below the video. But again, parasitology testing is important. I see lots of my patients have already come to me with conventional tests from their physician or their local hospital, and they commonly come back negative. I had a patient come in, no infections, came back the next week with a specific testing that we do with Giardia. So I wish it was as simple as all tests are created equal, but that's not the case. So I've really done my homework and tried finding some of the best, most cutting edge tests out there that maybe use polymerase chain reaction that looks at more DNA. The quality of the parasitologist and the stains that are used are really important so that you can see the infection. And just really using multiple samples. A lot of tests don't have enough samples. The more samples you have, you increase the chance of finding the various antigen or the piece of the parasite in the stool. So again, if you have any hormonal issues or gut issues, feel free and check below the video. I have various video series that are totally free. Check those out. And again, if you're suffering from a gut issue or a symptom outside of the norm, we always think infection. Check below and you can schedule a consultation with me. Again, thanks for staying tuned here, and more videos will be coming your way right away. Thanks.